I'm Dr. John Kruse, and today I'm going to be talking about cardiovascular effects of stimulants and actually other ADHD medications as well. Not just stimulants, but most of our norepinephrine boosting medications have a slight increase on blood pressure, a slight increase in heart rate. Those are not on average big increases, but we know elevated blood pressure over many years can cause damage to many organs. Most of the studies to date, including most of the meta-analyses, have failed to show that there was any risk to cardiovascular health from stimulant medication, particularly has been looked at. That's mildly reassuring, but only mildly, because most of those studies were done over the course of a year or less. And again, this is generally a problem that takes longer to develop. And there was a lot of media attention when in November, a study conducted by researchers at the respected Karolinska Institute showed that there was a statistically significant increase in new diagnoses of hypertension and arterial disease in a fairly well-conducted controlled study of people who had both ADHD and were taking stimulant medication. On the other hand, they did not find any what I would call more serious outcomes, so no elevated risk of cardiac death, arrhythmias, of strokes, or other thromboembolic processes. And I would maintain that this is more a public health issue, so that there was an overall increased risk. For individual health, it's probably a pretty minor decision point, and we'll get into that. Why are we so concerned about cardiac effects with stimulant and other ADHD medications? Why aren't we spending a lot of time on kidney or liver or other problems? There are two important effects, primarily of norepinephrine on our cardiovascular system. One is that there's direct sympathetic nervous system innervation of our heart. That's what helps our heart speed up when you're faced with a stressful fight or flight stimuli. That means externally drug-mediated boosting norepinephrine can also have effects on heart rhythm. An underlying congenital heart problem could, giving a stimulant, street stimulant like cocaine or prescription stimulant like Adderall, could that trigger a dangerous arrhythmia? And an arrhythmia is just an abnormal rhythm to the heart. Yes, it can, and those can kill people. What we know is that most arrhythmias that people have tend to be genetic causes, genetic malformations in the electrical wiring in the heart, sometimes genetic malformations of the heart, its structure itself. Since most of these tend to run in families, usually screening family members or asking if the person's had any family members who dropped dead suddenly or had a heart attack is an effective screening tool, and or if they've had any other suspicious incidents where they fainted without any clear provocation or others. So anyway, stimulants, again, can exacerbate an existing abnormal heart rate. And every year there's a professional athlete or a college athlete, someone who's in good shape, who drops dead or has a heart attack in the court for, again, arrhythmia issues. Kobe Bryant's son a year ago had such an occurrence. And again, that can be triggered by cocaine, meth, prescription stimulants, even over-the-counter decongestants. Those are rare. One of the most interesting studies wasn't done as a study, it was done as a public health measure. In Canada, they were concerned enough about this for when, shortly after Adderall XR came out, that they completely banned Adderall XR from the Canadian market for, I think it was about 18 months, it might have been closer to a year. And then they crunched all the numbers and looked. And this was basically kids, because in that day and age, it was mostly kids who were diagnosed and treated for ADHD. And when they actually crunched the numbers, a smaller percentage of kids who were on Adderall XR had sudden cardiac deaths than controlled population kids who hadn't been exposed to it. Now, it was not a statistically significant difference. I'm not pretending that Adderall XR saves people's lives. What it almost certainly reflected was that Canadian child psychiatrists and pediatricians were doing a good job of screening out people who might have had a rare abnormality of the heart to begin with. And once you screen those people out, again, there did not seem to be any increased risk from Adderall XR. That's the arrhythmia issue, again, the direct heart issue with stimulants. The second issue, the arteries in your body are essentially an extended, elongated version of your heart. They have the arteries are muscular, and the contraction of the muscles in the artery wall are influenced by norepinephrine. So if you're giving someone drugs that are boosting norepinephrine, even if you're targeting the brain, you're likely to be increasing that tension throughout the body. If your blood pressure goes catastrophically high, so blood pressure is two numbers, the systolic first, the diastolic. The systolic is the pressure when the blood is pumping, squirting it out through the body. The diastolic is when the heart is relaxing, but its blood pressure doesn't drop to zero then. So that's measuring the diastolic. The second number is some measure of sort of the resilience or flexibility of your arterial walls at rest. Anyway, catastrophically high, and catastrophically is usually systolic numbers that are approaching 200. If you're getting really, really high, that in itself can cause immediate danger. It could dislodge clots that are in your blood vessels. It could weaken or break places in your vascular system that have already been weakened. So if you have what's called an arterial venous malformation in your brain or elsewhere, that could rupture and leak with really high blood pressure. But most of the time when we're talking about blood pressure increases, we are not talking about any major immediate impact. When you're exercising, your blood pressure may well be in the 160 to 180 range. I'm in good shape. Was a marathon runner. I did 100 marathons, but when I had a cardiovascular test measuring some VO2 max, oxygen capacity, and other things, just a simple bicycle exercise machine, they were recording my blood pressure. I was shocked that it was between 160 to 180 when I was exercising hard. And they said, that's not something to worry about. That's what we see routinely. So elevations of blood pressure, your system is built to tolerate fluctuations because you need to pump more blood at certain times than others. But again, we know over a long time, if it stays elevated, that does cause damage to particularly small blood vessels, and particularly to organs that have lots and lots of small blood vessels or capillaries. So the eyes can cause eye damage, the brain can cause damage to white matter and mini strokes. It can cause damage to the kidneys. So we know long-term hypertension is a silent killer. It can have bad effects on lots of organs. Another organ, lots of small blood pressures is the penis. So erectile difficulties are often a long-term consequence of elevated blood pressure. On average, though, when you look at how much Adderall, Vyvanse, Strattera increases blood pressure, it's pretty small. Most studies find an increase of less than 5 points in systolic blood pressure. For most people, that is not putting them in the range of hypertension. And our definitions of hypertension have varied over the years. They do vary somewhat with age group, but usually it's higher than somewhere in the 130 to 140 range for systolic. So again, most people are not pushed into the hypertension range by these medications, but maybe the long-term cumulative effects of being on average a little bit elevated may have bad effects. So that's what these studies are looking for. Separately, even though the average number is just, again, 5 points or less for blood pressure and usually 5 points or less for increased heart rate, that's hiding the fact that many people on these medications have absolutely no measurable increase. There have been lots of studies failing to find any impact, and one of the most thorough and best meta-analyses came out about 2 years ago. They looked at cumulatively 19 studies, almost 4 million people, and what they found was no statistically significant difference in the onset of new cardiovascular events or diseases from ADHD medications, including stimulants and including non-stimulants like Strattera, or Wellbutrin, increased blood pressure. There were no increased events in children, or none in any age group up to including older adults. They couldn't find increased problems in men or women, didn't find increased problems whether they looked at stimulants or non-stimulants, and they didn't even find any increased cardiovascular problems in people who were on these medications who had pre-existing cardiovascular conditions. So specifically, no increase in heart attacks, myocardial infarction, or other low blood flow to the heart conditions, no increase in arrhythmias, no increase in cardiac arrests or heart stopping, and no increase in cerebrovascular, so essentially stroke or transient ischemic event. So that sounds really darn reassuring, except almost all the studies were year long or at most a year or two. That's a pretty short rule to look for problems that are probably going to accumulate over a lifetime. So there was quite a flurry of activity when in November, many of the members of the same group led by Li Zhang, an epidemiologist at the Karolinska Institute in Stockholm. The latest study released in November was not a meta-analysis. It was looking at the entire population of Sweden. There was some increase in newly diagnosed high blood pressure and newly diagnosed arterial disease conditions associated with being on ADHD medications. And specifically, they pulled out everyone with ADHD. That means they either had a diagnosis for ADHD and or were on ADHD medications, took out the people who were on ADHD medications that were clearly written for an indication other than ADHD. So if you took Vyvanse for an eating disorder rather than for ADHD, you were not included in the study. The study was open for 13 years, so some people could be followed for as long as 13 years. That was a very small number. Most people were followed somewhere between 2 to 7 years, with the median of 4 years, so considerably longer than previous studies. Took each case or each person who developed a cardiovascular condition after they started ADHD meds, pulled out from the population of ADHD controls 5 other people who were matched for age, gender, education, country of origin. Much of Sweden is fairly homogenous, homegrown, but they have an immigrant population as well, particularly increased in the last decade. And they wanted to make sure that both populations of the control and test case or cases were similar in that respect. Then looked at is compared the duration of people who are on medication who developed a condition and compared it to the duration of medication use for people who hadn't developed a condition. So what they found, one thing was that only 4% of the subjects with ADHD had a new cardiovascular diagnosis on the charts during the time of the study. That's a pretty low sample. On the other hand, the average age of the samples, they looked and they were studying kids, adolescents, young adults, middle-aged adults, even elderly adults. I think 65 was their cutoff. So only 4% having a new event over an average or a median time of about 4 years is a pretty low rate. But they did find that hypertension and arterial disease did increase during the first 3 years you were on medications. They used odds ratios. The odds ratio reached about 1.2. That means you were 1.2 times more likely to develop a cardiovascular condition in those first 3 years if you were on medications than if you weren't. So we were about 20% more cases due to being on medications than not. Again, comparing it to an ADHD control group. And that odds ratio risk increased almost to 1.4 if you followed it all the way out. So there's a fairly steep increase and then a much more gradual sort of leveling out. 40% by the time, you're looking 7-10 years in, 40% more people who are on stimulants than people who are not. And again, these are ADHD individuals in all cases, developed a cardiovascular condition. Now that number might sound alarming, but again, we're comparing percentages. In this population, cardiovascular events were actually pretty uncommon. So the absolute likelihood of developing a bad condition is pretty small. So a few other things. There was no zero statistical significant increase for arrhythmias, no increase in statistical risk for heart failure, for ischemic heart disease, so heart attacks, shorted angina, problems with not getting enough blood to the heart. No increase in strokes was measurable, and other what are called thromboembolic conditions, so having a clot and sending the clot somewhere to the lungs or elsewhere. Other things about the problem, and this is one that the authors acknowledged, is that there's no control for the severity of ADHD. So it might be that people who had more severe ADHD and had greater life dysfunction and or greater stress, and we know stress is a risk factor for hypertension and other forms, so that may So it might not have been even ADHD medications. It could be they were looking at a more severely afflicted group with ADHD, and that was what was increasing the risk for cardiac problems. So they didn't measure ADHD severity. There's no evidence that they actually wound up with a more severe population in terms of ADHD symptoms, but they might have. Other caveats are that, again, this is still a fairly young cohort, the average age of 34. Most of our cardiovascular diseases, particularly those caused by long-term hypertension, are caused by long-term, not short-term. Again, that's part of the reason don't freak out if today or in the doctor's office your blood pressure is elevated. Blood pressure goes up and down all the time. Potentially confounding variables, they matched for age, gender, education, country of origin, and they recorded health conditions ahead of the time. And there were a few categories where the cases, those people who did develop a cardiovascular condition, had higher rates of obesity, higher rates of diabetes, higher rates of substance abuse than the controls. So it could be that some of these other physical conditions that were going on, rather than, again, the ADHD medication, that were the contributors. There was one analysis looking at the dosage of ADHD medication, and there did seem to be some increase with higher doses. It was not a huge effect, but it was going in the direction you would expect if there was really a effect from the medication. So what do we do about this? First of all, the question I'll address is who needs an EKG before they're starting stimulant medication or other ADHD medication. Several cardiology groups have said, if you take a careful family history, if you take a careful personal history, these events are so incredibly rare. Screening with an EKG is not that likely to be productive or useful. So I know that there are lots of my colleagues who I will say are overly cautious or overly concerned and routinely order EKGs. I'm convinced that that's in general a waste of medical time and money. Certainly, absolutely, if someone's had a history of suspicious cardiac events and or cardiac events at a young age, cardiac events are the biggest cause of death in America. The more people die from heart attack, stroke, cardiovascular disease than die from cancer. Eventually, many people die from this. But if you die at an elderly age, that doesn't mean this runs strongly in your family. The other reason to get an EKG is if someone's so anxious, so you can effectively treat their anxiety by getting an EKG. In terms of blood pressure, I think it is good practice for everyone before starting any of these medications to have blood pressure recorded. Home blood pressure devices are fairly cheap, fairly accurate. I would argue they're at least as accurate as sphygmomanometers in the doctor's office. I don't think that most nurses, doctors, or staff members who are pumping up the cuff themselves and listening are actually knowing what to listen for. And I say that from personal experience. They look at me and they say, oh, young, healthy, maybe not so young anymore, and routinely put my blood pressure down as in a normal range when measured by myself on devices or others. It's been routinely high for decades. I actually am on hypertensive medicine now. Blood pressure should be checked. How frequently it should be checked when someone's on the medicine? I would say if after several months of being on the medicine, numbers have been consistently normal or there's no change, then unless you change the dose of medicine, I don't think it's warranted to keep following blood pressure. You can if you want. So what do you do if your blood pressure is elevated on these medications? First thing is lower the dose of medications. Many times people can get most of a beneficial effect from a lower dose of their stimulant or their non-stimulant medication. It's also perfectly fine to treat blood pressure with antihypertensive agents. Most of them will not block the beneficial effects on ADHD. I've had many people, mostly who already had known hypertension, who needed to adjust their blood pressure and medication doses when they started on a stimulant. So there is at least one study looking at Ritalin that suggested increased blood pressure during the daytime, but actually didn't have an effect on nighttime blood pressure. So that brings up the question of whether more prolonged or extensive drug holidays would be an effective way for avoiding some of the potential long-term consequences of hypertension from stimulants. Possibly. We're talking about any Ritalin product, any stimulant, any amphetamine-containing product are long-acting products better or worse than short-acting. I'd say for hypertension, the evidence is pretty weak that you're better one way or another. Definitely Strattera, atomoxetine, Wellbutrin, bupropion, duloxetine, Cymbalta, Savella, milnacipran, Sunosi, which I talked about a few weeks ago, solriamfetol, Qelbree or viloxazine. All of these increase blood pressure slightly. The Swedish study did find a slightly lower risk for Strattera, but it was still an increased risk over time for cardiovascular events. So that covers almost all of the potential ADHD medications. I mean, one exception is guanfacine. It originally was a blood pressure and is still a blood pressure lowering agent. That should not have this risk. And it's I would say it increases the attractiveness of adding guanfacine to any of these other agents to potentially mitigate any blood pressure elevating effects. Buspirone, which I talked about a few weeks ago, which is not a first or second or usually even a third round choice for ADHD, but may help some people, should not increase any blood pressure risk. So that's clean in this regard. I'd say conflicting data with modafinil. A number of studies failed to show any significant blood pressure increase. Other studies have. With all of these substances, there probably is a dose-dependent effect. So again, the lower the dose, the less the risk. Whether modafinil poses a lower risk, my clinical impression so far, just from looking at people's blood pressure and on different substances, is that it's cleaner. But again, I'd say the data goes both ways. Other factors that contribute to hypertension, but that are linked with ADHD. Lack of exercise is one. We know the healthier condition your heart and blood vessels are, the more likely you are to resist other effects that might increase your blood pressure. Again, there's certainly many athletes who do still have high blood pressure, but lower rate than the general population. ADHD is associated with being overweight. If you lose weight, that's a often very effective way of normalizing blood pressure. And sleep is a huge one. So sleep deprivation, getting less than 6 hours of sleep a night, is clearly linked with increasing daytime blood pressure. Again, the bottom line, though, is that this effect is a fairly small one. I think it's more important at a public health level. And by that, I mean, if we're giving these drugs to lots of people, even if the odds ratio increases 1.2, 1.4 for what I'd say is the less serious outcomes, that's a measurable increase in the number of people developing these conditions over time. On the other hand, for a given individual, is that mark, again, only 4% developed a new condition. So even if it's completely all attributable to stimulant medication where there's no indication it is, that would suggest, and we know the odds ratio is about 1.2 to 1.4, that would have meant that probably out of 3% chance over 4 years of developing a new cardiovascular condition, and you've increased it to 4% risk instead of a 3% risk. Is that clinically meaningful to an individual? Now, if they are among the people who develop hypertension, they may feel bad. They may want to consider what's a better trade-off. And again, usually blood pressure returns to lower normal values once you get the drug out of your system if you're stopping in the first months or years. I would argue for most individuals that's not a particularly heightened or dangerous risk, but that would be something for each individual to discuss for themselves. So I will check whether I have questions right now. So LD Van VA is a 50-year-old who's been on stimulants for almost 20 years. This is an important topic as blood pressure is creeping up over the years while on stimulants. And again, what makes it really difficult to know is that on average, 50-year-olds do have higher blood pressure than 40-year-olds and do 30-year-olds. Particularly in the American population, there is a trend. So yes, are there any decent ADHD meds that don't mess with blood pressure? And guanfacine would have to be at the top of the list. Lots of people don't find a strong effect from it. It does take longer to work, but it is verifiably helpful in many people. But essentially, with maybe the exception of modafinil, and there I'd say it's sort of equivocal, everything else we have has some risk. There is very weak evidence that the stimulants have a bigger risk on increasing blood pressure and therefore a bigger risk for potential long-term complications. Patty W. asks, would risk be canceled if treating symptoms of hypertension with an antihypertensive med? So as far as we can tell, the mediating factor for all these other cardiovascular events and problems, with the exception of arrhythmias, are mediated by hypertension. Now, I don't know specific studies in an ADHD population with stimulants, but I know other studies treating hypertension regardless of what caused it. If you're effective in treating it, you are lowering your risks of long-term cardiovascular events. So LD Fanva also says, I would think beta blockers might cancel the effects on the heart and prevent hypertension problems. So yes, beta blockers, certainly though other classes of agents, beta blockers do make some people feel drowsy or lethargic. They also can treat stage fright, performance anxiety, how well they treat other forms of anxiety. And again, anxiety itself is a big trigger for hypertension, but hypertensions in general, not just specifically beta blockers, should again be effective in alleviating this effect. Dr. Datis Kazarian said that without stress, we would be depressed. I've used the term stress loosely here, and I used it in a pejorative sense. So stress in terms of meaning, are there variations in the environment and in your interactions that are going to make you respond, react, I think are essential for a meaningful and fun life and essential for maintaining the homeostatic regulatory systems at cellular and other levels. So getting back to Cannon's original definitions of stress, which is essentially anything perturbing the system, yes, I would say stress is essential. Would we be depressed with it? I think we might be bored, but I don't know that I would equate depression purely with boredom. So that's my answer there. So KB says high blood pressure since age 30, diagnosed at age 51, started Adderall 2 years ago. My blood pressure was controlled on meds and minimal increase from the med at start. I've lost weight though, so now blood pressure lower. So yeah, so again, it's important to look at the whole bucket of things. So for many people, stimulants actually reduce anxiety. Stimulants can help with weight loss. Stimulants can actually help people sleep better. They don't do that all the time. They can have the reverse effect in some of these situations, but it's quite conceivable that stimulants in someone's life with ADHD actually lowers their blood pressure. When I seek treatment for my hypertension, doctors blame me for taking ADHD medications. How do we deal with that? You can try to explain that you're trying to work with them, that you have a serious condition, and ADHD, you can refer them to the statistics, is a serious, it shortens life as much as depression does. On average, kids diagnosed with it live 10 years shorter than the average non-ADHD kid. Unlike many of the conditions that doctor treats, affects your functioning every single day. So I guess, hypertension is not affecting your functioning day to day. It may have long-term health consequences. How you function socially, how you function professionally is likely affected by this. This is important for you to continue to be able to function and be a contributing member of society and afford health insurance. So a second question is, some psychiatrists are comfortable either continuing blood pressure medication once they've been started by others, or some of them even starting themselves. I would sort of ask him what are his concerns other than that ADHD medications are adding to your hypertension, because my response to they're adding to the hypertension is a condition we can treat pretty well. So part of it is induce a sense of cooperation on your doctor's part. Hopefully it's already there, that the two of you are trying to help you function better in your world, which includes job performance, includes how you interact with others, and it includes your physical health. If he has suggestions for ADD effective medications that aren't going to affect blood pressure and can come up with something other than guanfacine, great. So KB asks, doesn't Adderall and most other stimulants stress the body, producing more cortisol, and isn't that bad overall? That's actually a good potential topic, partly because I don't know the answer. Is there a general correlation with increased cortisol levels or secretion in stimulants? To my knowledge, no. So again, getting back to the person who asked a question about stress, when stimulants tend to be at effective, useful doses, I would argue most people, and the best example is when people switch from Adderall IR or XR to Vyvanse, and they describe it as feeling smooth. They're not feeling tense or not feeling revved up. So feeling tense, feeling revved up is not a prerequisite for getting a good cognitive, social, brain benefit from a stimulant. And to me, if you're feeling tense, if you're feeling stressed out, almost certainly in my book, you're on too high a dose of a stimulant. Usually it would be lowering the stimulant. It would also be looking for are there other things like getting enough sleep, exercise, diet, other medications we should consider adding on, like guanfacine. Again, I will check the cortisol and stimulant, but I don't know that what I would call a therapeutic dose of a stimulant, I would not necessarily expect it to lead to high cortisol. So that's about all I see for now. Thanks. There are great questions, and I'm glad that so many of you are interested and engaged. So stay healthy, stay happy, and thanks for all the support and engagement today.